So we are now coming to our discussion round, and we entitled this discussion, "What can we achieve together on cancer prevention action needed at the EU level?" So, and we will have two key opinion leaders from the European Commission. First, Mr. John Ryan, and John Ryan is a Director of Public Health Country Knowledge and Crisis Management, DG Santé, and Ms. Brigitte Sacardus. She's a rapporteur of the European Committee of the Regions and the Interparliamentary Committee meeting on Europe's Beating Cancer Plan. So it's really great that you're with us. Thank you so much. And I will invite first Mr. Ryan to present on the work of the Commission related to Cancer Plan, and then to you, Mrs. Sacardus, to underline the importance of commitments at regional level for the implementation of the plan. So please, Mr. Ryan, first.
Thank you very much, Professor Berg, and it's a great pleasure to be here with you today, and I've listened with great interest to the presentation so far. The Europe's Beating Cancer Plan was an initiative of the current European Commission, addressing cancer in a fairly integrated health in all policies approach, I would say. We are, of course, and we were, of course, aware of the impact of liver cancer on the lives of patients and also on our health systems, which, as you know, at the moment are under severe burden. So this is a factor which also needs to be taken into account. And when we were drafting the cancer plan, the Europe Beating Cancer Plan, we tried to identify actions on prevention in the area of early detection and screening, on diagnosis and treatment, and finally on quality of life of patients and survivors. So through this, the Commission tried to identify actions which would have a value added at European Union level. And we hope that through the implementation of the Beating Cancer Plan over the next 7 years, the burden from mortality and morbidity in respect of liver cancer will be favorably influenced, shall we say. So since the adoption of the cancer plan earlier this year, we have been careful to try and mobilize involvement of anybody who could help with the implementation. For example, we have a group of member states which has met already many times to discuss the individual actions identified and to make sure that these actions can be properly carried out at the national level. As I mentioned, it's a One Health approach. So we have actions in the cancer plan which concern taxation, which concern the workplace, which concern the agricultural policy. And therefore, it's important that we involve these policy departments. So the Commission as a whole has been brought together in a group to follow the implementation of the plan and to make sure that all of the actions we promised to do will be implemented through the different policies. And finally, and perhaps most importantly, we have established a group of stakeholders. So the stakeholder group invitations have been sent out. We're receiving applications now from individual groups who wish to join the stakeholder consortium or grouping. And we hope to have the first meeting in a few weeks' time as soon as the membership is stable. So you can see here, involving the member states, involving stakeholder communities, involving the other policy departments, I think would be really important. Now, we have also started to use our financial instruments to support the implementation of the plan. We have two programs which I would mention particularly. We have the EU for Health program, and we have the Horizon Europe Research Program. And I think Barbara Kerstens, my colleague from DG Research, from the Directorate General for Research, will be speaking to you later on more in detail on the research program and on the cancer mission there. But I wanted to mention that already this year we have published 12 grants, action grants, publications already in July, and a second round now in October. And we've launched 4 joint actions with the member states. So a total of 16 individual actions which are being financed through the community budget have been launched already this year. And if anybody who's online would like to have details of these initiatives, these financial initiatives, please let me know. We also have some of these which have just been published and which will be still open for participants to join until the end of the year. So please get in touch if you think that there's something where you might be able to contribute. Now, through the research program, there will be a strong boost in research, innovation, in data, in digitalization, new technologies, new pharmaceutical products. These all have the potential to help in respect of the prevention and management of cancer. We need a better infrastructure in place, for example, to have up-to-date and comparable health data on liver cancer. We heard several people talking about the need for better registries. This is something which we hope digitalization and better digital tools will help us to develop. We also have a new knowledge center on cancer, which brings together our existing work on registries. And this is run by the Commission's Joint Research Center. A third initiative in this area is the area of cancer imaging. And we will be establishing next year a big initiative to improve the quality of cancer imaging. Perhaps would be able to contribute as well to earlier diagnosis. And my colleague Barbara will speak in more detail about this later on. On the second area of prevention, which is the topic of this event, I wanted to say that the previous health program, the one which ran up until 2021, has already invested heavily in the support for prevention initiatives, particularly focusing on disadvantaged groups. And this has also been matched by similar investments from our research program. And we want to continue this now in our current financial round. Under the cancer plan, for example, the Commission will help to ensure access to vaccination against hepatitis B and to treatments to prevent liver cancer associated with hepatitis C. To this end, we'll propose a council recommendation, in other words, a legal text on vaccine preventable cancers to help to address cancer risks associated with hepatitis B and human papillomavirus infections. Under this year's financial spending, which I spoke about earlier, we wanted to launch these action grants, which I mentioned. And some of these cover, for instance, the access to human papillomavirus vaccination and reducing liver cancer caused by infections. And there are also grants to improve human papillomavirus vaccination in the member states. So you can see it's not only a question of making promises, it's also a question of developing and financing actions on the ground in the areas that we have agreed as being priority. So I think as well, we need more ambition in our actions on health promotion and disease prevention. Our colleague from Denmark spoke earlier on about the evidence that's attached to the effects of good prevention. And we are reviewing, for example, the agri-food promotion policy. We have in the agricultural policy in the European Union money which is set aside to promote the consumption of agricultural products. And we want to make sure that that's done in a healthy way. In other words, reducing the promotion of products which are high in fat, in salt, in sugar, and in trans fatty acids, for example, or also alcohol products. So we want to make sure that in a health and all policies approach, we also include healthy messaging in the Common Agricultural Policy promotion. I'd mentioned on alcohol, since several people have spoken on alcohol, that we are reviewing the EU legislation on alcohol taxation, particularly as regards cross-border purchases of alcohol. Whereas, as you know, at the moment, it's rather difficult to control the quantities of alcohol which are brought tax-free from one member state to another. No, not tax-free, they have to be tax paid in the country of origin. But if you go shopping for alcohol, you can find, of course, countries with cheaper rates of taxation, and then import those without paying the taxation in the country of consumption. So we're reviewing that at the moment. We're also reviewing the nutrient content of alcohol products, and we're proposing to put warning labels on alcohol products. So you can see we're not entirely inactive in relation to alcohol either, because we're looking at the taxation aspects, we're looking at labeling aspects, and we're looking at the nutritional content of agricultural products, of alcohol products, particularly in the context of cancer. On obesity and nutrition, of course, we're also looking at the EU school fruit, vegetable, and milk schemes in order to make sure that these correspond to the promotion of products and the making available of products which are which are healthy to our school kids. And secondly, of course, on reformulation of food products to try and reduce sugar and salt content of food products. So you can see there's quite a lot going on the nutritional side as well. On early detection of cancers, we have a council recommendation already on cancer screening. This is being reviewed by our scientists at the moment in order to check whether we could extend the screening approach to other types of cancers, and also what are the new techniques which we might use for cancer screening. And we're proposing a new council recommendation, a new legal text next year. On diagnosis and treatment, I'm in a whole series of actions by setting up a cancer training program, an interspeciality cancer training program. This was launched in July, and you can, we would be very happy to provide the health professionals online with further details. There's a structural initiative to link together comprehensive cancer centers in each member state. And of course, our pharmaceutical strategy, which is going to be delivered before the end of the year, will also make a contribution to better innovative treatments and making available of those innovative treatments. Lots of people have spoken about inequalities in hepatitis and liver disease, and I just wanted to flag a fairly innovative approach that we've taken is to establish an inequalities registry. This is being developed for us by the OECD, and the member states are closely associated. We also hope to associate the stakeholder community. And we hope by doing this that we'll have several reality checks at different points, and that we won't have people ticking boxes too easily, but that we will have actual checks with patient groups, for example, in order to make sure that what the member states are telling us is actually reflected on the ground. I think this inequalities registry is going to gain great importance over time. And raising public awareness is also mentioned by lots of people so far. We have the European Code Against Cancer, which is like 12 major messages which were developed by the International Agency Against Cancer. And these include, for example, limiting your alcohol content intake, eating a healthy diet, maintaining a healthy body weight, be regularly physically active. So, and lots of information and communication campaigns built around that scientific consensus. And we want to really promote that as well as part of these efforts. One or two more points, if you can spare me a moment or two. One or two more points. First of all, we have a more general approach to vaccination since 2018, involving as well the health professionals. Nurses, doctors, pharmacists are involved. The idea is to bring everybody on board to try and promote vaccination. And we launched this before COVID. And I can tell you, the problem hasn't got any better, it's got worse. So really we have to try and find ways of continuing this effort to promote vaccination, because it is a very effective public health measure, including in the area of liver cancer. And finally, I mentioned our two agencies, the ECDC, the European Centre for Disease Prevention and Control. I was looking at their page, I was surfing on their pages when I was listening to you earlier on, and they have hundreds of documents and hundreds of recommendations to deal with prevention of hepatitis in particular settings as well. You were talking about vulnerable groups in prison settings, for example, in migrant settings. I don't want to stigmatize anybody. I'm just saying that, you know, there's a special need for a special approach in some specific settings, and the ECDC has developed a lot of science on this, but also surveillance and so on. And finally, of course, the Drugs Centre, the European Drug Centre in Lisbon, has a huge focus on elimination of hepatitis. So I really think that the European Union is not inactive in this area. There's a lot of stuff going on, and it's a pleasure for me to have the opportunity today to say a few words about this. Thank you very much again.
Yes, thank you, John Ryan. Very informative, and of course, it's quite impressive what you have told us. And it's needless to say, when I think all the medical societies saw what are you doing with the EU for Health, and especially really with these very comprehensive and ambitious beating cancer plan, we all felt this is very timely and a very important initiative. So it's my pleasure and privilege over to you to again introduce Brigitte Sacredus from European Committee of the Regions and the ICM. So please, Brigitte.
Well, I think we now have a very good example how important it is to work multi-level governance. As a policymaker, we have to have contact with each other and help each other out to, for example, the cancer plan. And just so you know that the member states, they are responsible for financing, organizing the healthcare system. But in 19 out of the 27 member states, it's the region or the local authorities that have the primary responsible for healthcare. I myself, I'm in Sweden, in the region of Dalarna, and I'm responsible for the healthcare. So it looks in many other countries in Europe. And EU is responsible, like you heard from John Ryan, can help us on the health issues. And I think EU has done a great job when it comes to smoking. Who could think that people have stopped smoking in restaurants? Well, this is now the case in the 27 member states. Smoking is not allowed in the restaurants. And I think we can work like that also when it comes to alcohol. We can do much more when we can have campaigns like we had for smoking, the non-smoking generation and so on. We can have campaigns about this because alcohol is very, as you know now, very important to reduce the alcohol drinking. And in Sweden, we have an example, but I know the Nordic countries are really different, but it's not so easy to have access to alcohol. We have special shops that is open special hours. And that's one way to try to decrease the alcohol problem. And also, John Ryan was mentioning labeling of alcohol. I think this is really necessary that we put this forward on the EU level. When it comes to obesity, of course, city planning, and that is done usually on local and regional level. It's important to be able to move. We know that it's so important that we are active moving for our health. And there we must have good pathways, parks where you can run and have access to sports. And I would tell you in my region, what we have done is that we have now a commitment together with the sports academies. So they go into the schools and make the youngsters start to move much earlier. So if you want to have a change, start with the youngsters. And that's what we are doing. We ask the sports clubs to go into the schools and do more work there. So this is really important. And also chemicals that are causing cancer. EU is working great job there too, trying to find and take away chemicals that are not good for our health. And also the pollution, EU has towards zero pollution for air, water, and soil. That's also very important to reduce cancer. And we also, John and Ryan also talked about what we can do with agriculture. What we eat is important. And I think it could be more there about nutrition labeling, so we know more what we eat. And also as a policymaker, I think it's really important to where we have our advertising, so we don't advertise bad things, that we have a restriction there. What I also is proud of is that really stress the cross-border healthcare, that if you don't have the ability to get health help in your country or region, you can go to another country. So the cross-border care is really important, that we can stress even more. And what I also was happy to hear is that we have cancer centers that we should try in Europe on European level to put data into a common center. In Sweden, it's great because we have cancer centers, and they are divided into 6 centers, and the regions can go there and find digital, and also they have meetings, because it's really important that will be top-down knowledge. I mean, the health workers that meet the patients should have this knowledge, what to do. So it will be early detection. What should they look for? So here we have to have a top-down look at this. So these cancer centers for Sweden has been very, very important. So I hope that in each country you have cancer centers, and that you can, that we also will have this and give information on EU level. And we have standardized programs. If you get a liver cancer, for example, you should have a standardized program, what steps you should do. That is national now in Sweden, and I hope you will have that also in your countries. And the most important thing is, of course, to empower each citizen, include ourselves, to be able to find information if we are worried, if we get cancer. That's why digital knowledge is so important. And EU is working for the digital issue, and so we do in national and regional level. So we all have easy access to knowledge. So digitalization is also a key to solve more of the cancer problem. So thank you. And I wish you all that work with cancer, the health workers, good luck in your work. And also we have to get more health workers. That stands also in my opinion, that we all need to get more people interested to work in the health sector so we can help our patients and our citizens. Thank you.
Yes, thank you, Brigitta, very much. And this is really something also, of course, EASL may want to contribute, you know, when you ask to have also more health professional to give advice, to be in contact. And we also tried a lot of, you know, having campaigns about the risk of hepatitis B or C and do a vaccination. But what we realized is that, you know, if you do these campaigns, people looking at it, watching at it, and sometimes we had it in the cinema or I don't know, before a movie starts, that people do not feel it concerns to them, you know. It's always the feeling, well, it belongs to someone else. And I really agree with you that empower the individual, that he get a sense on the individual risk factors, because we are not only talking about liver cancer, that's for sure, but we feel that liver cancer could be really this role model. And I think there's also the idea of liver health, because it's the organ of metabolism that also helps all the other cardiovascular disease if you have not a fatty liver and so on. But I would like to open now the floor to all the speakers and to ask questions. I can perhaps start with one coming here from our audience, and it's related to the Brexit and whether the UK will be now excluded from all the EU initiatives to address these very important problems, or there's still scope for engagement and collaboration. I don't know, John or Brigitta, would you like to answer first? John?
Yeah. So as regards the financial instruments, each financial instrument has a separate set of rules as regards UK participation. The UK basically have to buy in to individual programs. So if there were people from the United Kingdom interested in participating in an EU program, they have to check whether the UK as a country has decided to purchase its membership of that particular program. It's the same arrangement that we have with Turkey or with the accession countries, you know, that we calculate an annual amount and then they can join. Of course, it's possible very often to participate on a voluntary basis, but that's maybe not so interesting for some people if they don't actually have access to any of the funds. The third point I would make is that, of course, anything that's produced using EU money is publicly available. Everything is available as a published result. And of course, I guess that many of the European associations are European associations. They include people from within and without the EU. So we have colleagues from Israel online today, for example, and it's traditional, I think, in public health that we have an open door policy rather than a closed door policy. The UK is participating with the European Centre for Disease Prevention and Control in the sharing of alerts, for example, so that we know what's going on in terms of communicable diseases. So there is still a level of cooperation there.
Yeah, thank you very much. We have a question from Pierre Naon from France.
Hi, can you hear me?
Yes, we can hear you.
Yes, hi. Hi, everyone. Thank you very much, Mr. Ryan, for this very, very important information. And I was really pleased to hear about the will to promote grants for action programs in cancer. And I saw the grants that are currently being communicated around early detection for cancer. What would be your advice for our community if we wanted to participate to this grant program? Should we do it under the EASL patronage? Or do you have any advice? Because this is a very, very competitive field on this matter. And how do you take into account the heterogeneity of all healthcare level systems in Europe, in European countries? Thank you.
Yeah, John, please.
Yeah, so the process is as follows. We have a legal text which sets out the obligations or the ambitions of the cancer of the financial instrument. The financial instrument, in this case, we're talking about the EU for Health program, but we could be talking about the Horizon Europe research program. Then the Commission develops a work plan for each year. So N+1, we develop a work plan. The work plan for 2021 is obviously already adopted. And that's, if you look in the chat box there, I've published the actual details of the calls for proposals. The implementation of this work plan and the calls for proposals are published by an agency. So we don't do that. We actually set the targets, if you like, but the actual individual project applications are then evaluated by independent experts. So it's not by talking to me that something is going to get through or not get through. It's a completely transparent and independent process with outside experts who evaluate competitively each project. And my advice would be that the more partners you have in a project, the more substantial your chances would be of success. If you have, it's a European program. So in other words, if you have 3 member states involved with minor impact, shall we say, it might be very interesting in a specific case, but in the case of liver cancer, I think we need to have a much wider approach. And of course, in that, the more partners you have in, you can also factor into the project countries with higher or lower health systems resources and so on. So it doesn't all have to be the same solution for everybody. Yeah.
Yeah, thank you very much. Yeah.
My mask at everybody, but
yeah. So we have a question again from in the chat, and this is for you, Brigitte. Are the protocols for handling liver disease available outside of Sweden?
Good question. I don't know if they are translated to English, but of course you can look for the. I can write it down in the chat, the address where you can find this center. I can write that down.
Okay, thanks a lot. We will forward it, and we have 2 questions here from our speaker. First from Milan, and then from Maria Rake.
Thank you very much, Thomas. My question is directed to Director John Ryan. Hello, John. It's nice to meet you that I can see you today. I'd like also to ask about the countries around Europe who are applicants to be members of the European Union. We listen a lot that we have a lot of approachable funds. We can use it also in the area. But do we have a chance to applicate like let's say directly from this country like North Macedonia, Serbia, I don't know, Bosnia and Herzegovina, or we need to have consortium together with the cross-border countries from European Union like Greece, Bulgaria, and etc.
Well, I think there are 2 separate cases here. First of all, if a country from an accession country wants to join a project under an EU financial instrument, might be the research program, might be the health program, the accession country in question has to have access to that particular program. So that's the first thing to check, whether the country in question has access to the financial instrument. If they do, then they participate more or less on the same level as everybody else. So you're treated like a member state from the beginning, once you're admitted to the access to that program. The other scenario is that you want to do something on liver cancer, either in your own country or with a group of other concerned countries in your region. And there we have specific funds as well, which are outside the health program, outside the research program. These are what we call the neighboring or the accession funds, which are specific funds. And there you have a very strong case if you can show that it's something which the European Union itself is doing. So in other words, you could say, based on the European Cancer Plan, based on the actions that are specified there, we want to do something using the neighborhood funds in our country. And that will have a strong chance of success. We've done this already for antimicrobial resistance, for example, in the Balkans. In the Western Balkans, we've made a major investment in the Western Balkans based on our own EU action plan against antimicrobial resistance. So please contact me separately on that if you wish, or with your colleagues, and we'll get you the information.
Yeah, thank you very much. I realize that we are, well, a bit beyond the schedules, but I would like to allow for 3 additional minutes because there's some additional questions, first from Maria and then from Moika.
Thank you, Thomas.
And then we have the lunch break. Yeah, please. Okay.
Thank you, Thomas, for the introduction, and thank you for the presentation. I'm an expert in liver cancer in Spain. Here we have a lot of activities around the patient management, but one of the things that I would like to know from a European level, if you could consider the patient care as the shoulder of the patient. Now we are asking for prevention cancer. We will have some strategy for that. Cure of hepatitis is one, stop smoking and also alcohol intake is another, also hepatitis B. My question is, have you could consider a strategy that prevent liver cancer and also a screening program for those patients who receive this strategy, because maybe in this direction, regardless of the heterogeneity in Europe, we could have a better outcome that we have at this day. Sometimes we are focusing prevention, but then the patients are at risk, low risk, but they still have a risk. This is something that you could consider at a European level.
I don't know, Brigitte, would you like to answer or?
Oriane, both of you.
I was just trying to chat the cancercentrum.se. Now everyone has it. Can you repeat the question, please?
My question is, we have some actions to prevent liver cancer from European level. Do you plan to consider a strategy for those patients who were treated as a prevention cancer? My specific question is prevention and also follow-up with surveillance strategy for them.
I don't think that on the EU level, we don't do it at the regional level. Maybe John Ryan can give an answer to this. On national level, yes. I don't know on EU level. Maybe Ryan can give an answer to that.
Yes, thank you very much, Maria, for this idea. I would only say in response to you that this cancer plan is an open plan, it's not a closed plan. At the very beginning of my intervention, I said that we were encouraging the participation of stakeholders. That means medical professionals and patient groups. We have an open call at the moment for membership. We're inviting people to join us on this. So if you have ideas as to where you think our focus should be, if you think that something is missing, if you think there are gaps, please let us know, because it's very difficult for us to know everything that's going on all over Europe. You are on the ground, you're dealing with patients, you're treating patients, you're trying to prevent the disease. So it's really very good if you can intervene as well with us, give us your ideas, and working together with associations like the ones who are organizing today's event to actually come forward with concrete ideas and proposals, which we can then support.
Thanks.
A very important point. A very brief question and answer, please, Moika. You're muted. You're muted, Moika. Moika, you're on mute.
Yeah, I have a question. Thank you. Sorry. I have a question for Mr. Ryan. First, thank you for a very nice presentation. I just wonder, is EU planning to support the WHO hepatitis elimination strategy? And if so, what kind of support could be expected by the EU member states? Because, you know, there are huge varieties throughout Europe regarding the management of hepatitis C. Several real-life data are showing that. So is there any support going to be expected from the EU?
Yes, we had a meeting. We had a meeting 2 weeks ago with the director of WHO Euro, Hans Kluge. And earlier on this week, we had a meeting with the Director General of WHO in Geneva. So we are talking to each other. We are looking to see how we can work together on different files. COVID is a very good example where we work together every day. And I would say the member states and the WHO are aware of what we're doing, and we're aware of what they're doing. So there's a very close cooperation, in fact, with the international level. And we will use our financial instruments, whether it's in research, in the EU for Health program, or also in the structural funds, the various funds which have been put aside now for COVID recovery, to try and strengthen our member states. So that's the only answer I can give at the moment, but there is a very, very long tradition of cooperation with WHO.
Thank you.
Yes, thank you very much. Well, Marco, from your point of view, is there anything to add before we conclude the session?
So now I just wanted to say thank you for being here. Thank you for answering all the questions. I see we have some more questions in the chat. I received several questions through the email and other means of communication. So it seems that your contribution to this event was extremely valuable, and it sparked a lot of interest. So I'm hoping forward that we will continue with this pace. And in the name of liver patients from Europe, I would like to thank Director Ryan. We see you your work for several years now, and we see a big step forward and progress, and we hope that you will continue there. In regards of the all panelists, from the patient side, thank you for the presentations. We hope to continue, and after the lunch, we will see more concrete examples on testing and screening and what we can do there. But from my side, thank you. I'm giving the floor back to you, Thomas.
Yes, thank you very much. And I also would like to really express my thanks to all of you for excellent talks and having this very interesting discussion. I would also have loved to touch a bit on these issues we always have with bureaucracy, data protection rules, and what is meant with an interventional and non-interventional study, because it really creates sometimes really real obstacles in working together, having this registry, and perhaps we can touch on that in the second part, but otherwise this could be also something for bilateral communication. So I want to conclude. I think that we have shown in the first part that most patients in Europe and worldwide who suffer from liver cancer also suffer from a chronic liver disease. And I think it was also shown that it often takes decades for chronic liver disease to turn into a malignancy. And these decades could have been used to treat and often cure chronic liver disease and thus prevent liver cancer from developing. So unlike many other cancers, liver cancer prevention in the EU therefore focus really on a very specific group of population. And these are the people with chronic liver disease. Therefore, liver cancer prevention also means early detection and treatment of chronic liver disease. And I think, Mojca, we have seen your example from Slovenia, how effective this can be. So even after a couple of years, we see that the numbers are declining. So really a proof from real world.